Dr. Therian here, and if you're watching this video, it's likely because of the fact that we just talked about a subconj heme during your eye exam. And so this short video is going to be done to kind of reinforce, explain what we're kind of watching for, and that kind of thing. And so basically what's happened is you busted a blood vessel that's underneath the thin tissue, the conjunctiva, that covers the eye. The reason you busted that blood vessel could have been from rubbing it, could have been from sneezing, coughing, straining, being on blood thinners. You know, there's a million things that you do in your life that can cause subconj heme. And so one by itself is nothing to really stress out about. But if we start having multiple ones, they're happening frequently or reoccurring, then we need to worry about things and kind of pay attention to it. And so what's happened is busted that blood vessel under there. Now the good thing about the eye is a very walled off, well-protected area. And so it's really hard for bacteria and infections to get in there. The bad news about the eye is a very walled off, well-protected area. And so it's really hard for that blood to get back out. And so that blood will sink over time because of gravity kind of pulling it down. It may change colors just like a bruise as well. And it may go away in 2 to 3 days or 2 to 3 weeks. And so basically what you should notice is it may spread and get larger over time because of the fact that it's sinking down, but it should start to improve day after day and be gone within 2 or 3 weeks. If it's not gone in 2 or 3 weeks, give us a call, let us talk about it a little bit more and check on some things. And then if another one reoccurs really quickly, then we want to check on that as well. But things to pay attention to is, if you can, get off blood thinners, stay away from aspirin or ibuprofen, any of those non-steroidal anti-inflammatory drugs, because that can cause things to kind of leak a little bit more and make these a little more frequent. The other thing to pay attention to is there's no real drop to get rid of it. If the eye is feeling irritated from that little bit of swelling on the conjunctiva, you can use some artificial tears. Avoid the ones that say get the red out, because that'll actually shrink blood vessels and can start to mess with these and make them happen again pretty quickly. And so again, these should slowly heal over the next couple of days to a couple of weeks. If they're not healed up in 3 weeks, let us know. I understand that this video doesn't replace the need for an exam. It just reinforces what we already discussed during your eye exam. And if you have questions, we're always here to help.